Welcome back, friends. My name is Michael Yates. This is the Ridgeview Pod, where we try to cover everything hope, healing, and recovery related. We are glad you have taken time out to spend some time with us. All right, I'm super jazzed to have Chris Baker with me. Let me tell you why you're here, Chris.
Okay.
So Brandon Knight has been a frequent guest on the Ridgeview Pod. We like to talk about lots of different things.
I've enjoyed listening to your guys'
Oh, have
conversations.
you?
Yes.
Did you hear our reading list? The summer readings that we did recently.
I didn't, but I've shared some of your podcasts, so you've got a little national fame going on.
Oh, yay, yay! Well, that's good. So there are now 3 people that are listening to it. So now, the reason you're here is Brandon Knight said, you know who would be a great guest? You ought to have Chris from Genoa to talk about how important med adherence and co-location of a pharmacy is in helping our clients, our patients, our consumers. I thought, duh. Oh, yeah, why not? Why not? So that is why I'm sure it felt like I was badgering you for a period of time, but I'm so glad you're finally here.
I'm really excited to be here because, we love being part of the Ridgeview family. So this is really neat to get to talk about how, our partnership really helps patients.
Yeah. So now I always like to make sure I'm Genoa.
Mm-hmm.
Genoa. I always hear some folks say Genoa or some other variation, but the fact a name is a name by any
That's
other.
right.
All right. So yeah, here at the main center, we were fortunate enough about, what is it, like 3 years ago?
It will be 5 years in November.
Are you serious? See, that's what the pandemic does to your sense of time. It warps it.
We are so excited that we're hitting this milestone.
You guys opened up a pharmacy location here at our main center.
Yes.
And you've been our only pharmacist this entire time, which is awesome. So what has that been like? What's your sense of how important that's been in coordinating care between folks that are receiving med management and have the convenience of just moving one window down and there you are?
Oh, I love getting to answer this question. So, even though I'm just 21, I've been a pharmacist now for about 3 decades. Child prodigy at it. But but I come from the world of retail. That's what I've done all my life. And one of the hardest things for me as a pharmacist in retail, especially when you care so much for helping patients get, closure with an outcome, is when there's a problem for a patient and all you can do is tell them that there's a problem, offer a couple of solutions, but you can never do what I call closing the loop. You can never know if the patient really got the help that they needed. You never know if they're satisfied with how they got to the end. It's really hard to follow up. So when Genoa came here to Ridgeview and we were integrated with case managers and the medical staff and even with you all for like the United Way grant, all of a sudden what we did had so much more value to it because we could close the loop. We had people to connect with. They could connect with us. And I cannot tell you from the healthcare practitioner side just how good that makes us feel. But I think on the patient side, it also lets them know that there's a team that's as invested in them doing well as they are invested in it.
Yeah.
And that type of hope and help, I think, keeps people pushing forward when days are hard and things are tough, and they know they always have some place to come back to and somebody to talk to in the building that knows them and it's warm, and that's just a service we could not provide, when I worked in retail before. And I loved being a pharmacist, but it is in the stratosphere different now what we get to do to help people.
Well, you're the one that actually taught me the value of this phrase, medication adherence. So, being committed to a med regimen, staying on top of it, managing it well. It seems, clearly, I pass through, the pharmacy multiple times a day, and you and Ashley, typically you guys are smiling from ear to ear, just like that right there.
Yeah.
Uh, you can tell the patients love visiting with you. Sometimes you're even giving out goodies and treats, and depending on the season and the holiday and what have you. But what a rewarding sense of compassionate connection you can get when someone who is also helping you with your med regimen is supportive of that process, can answer questions, can liaison with the prescriber conveniently and easily. How can that not help but promote med adherence?
Ah, I love that. Absolutely. And I love the phrase compassionate connection.
Mm.
I really, really like that. And so it's, we know like if you want to start a new habit or a new diet, we know it's hard. So if you get diagnosed with a healthcare condition that you may want to see get better, but now you've got to add medication and maybe some lifestyle changes, it's putting a lot on your plate. And so medication adherence is a huge part in getting to, the goals that you're trying to. So some of the things that we like to do to help patients stay adherent, the first one is I call them the touches.
Uh-huh.
If writing a prescription was enough, I probably wouldn't have a job. Right? You just write a
Yeah.
prescription, somebody takes it off, they go. But it's so much more than that. So the touches, which goes back to closing that loop and making connections with patients and listening to their stories and knowing that their voice matters is as important because it helps their beliefs in medication helping them. It
Mhm.
helps their beliefs in getting to the goals that they're trying to. Those touches are incredibly important, but we also have tools, right? We're in the
Yeah.
business of science as part of healthcare, so we use things like medication packaging to help people.
Uh-huh.
People who either have a hard time remembering different times of the day to take their medicine, or people are used to the little pill boxes, but
Mhm.
sometimes with arthritis and stuff, it's harder to put them together. So we have pill packaging to help with
Mhm.
that. We call patients all the time to let them know when we have prescriptions for them.
Mhm.
We offer mail services that we don't charge for. We offer delivery services that we don't charge for. Basically, we try to think of anything that might make it hard for a patient to stay on track with their medication. And then we try to get out in front of that problem before it has to be a problem for
Mhm.
them. And so, even things like letting patients run accounts is a big deal because sometimes, the bills are big and money is tight. And we don't want interruptions in their medication becoming part of that story.
Mhm. Well, I mean, your testimonial and experience of providing that service, even you mentioned United Way. So when we do our panel review with the United Way team that comes in to determine levels of award and all that, they loved hearing what you had to say. It was some of the most real, valuable information that they got. We can provide data, numbers, demographic stuff, but to hear someone who's actually involved with the provision of the medicine and how their funding can help be that stopgap intervention before we can get them on insurance, or that helps them get that psychiatric evaluation, med evaluation that leads to the prescription. I mean, it was incredibly valuable, and I think you did such a good job. You ended up being highlighted at a board meeting, did you
I,
not?
I did. I
Yeah.
did.
So
So
be
thank
careful.
you.
Now you're on the
Yeah.
podcast. Next is WBIR TV.
Count me anytime I get to share good news. Count
Yeah.
me in.
Well,
Count me
I
in.
think that's become the middle name of this podcast is actually the good news. So,
Love that.
yeah.
Love that.
Well, with respect to good news, and we know the work is hard. Certainly, the pandemic has brought additional complications to everyone's self care. But I'm always curious, how do people take care of themselves? So, how have you been taking care of your own and be a steward of your own mental health during this time?
That's a great question, and I think one of the first things that comes to mind when you ask that is laughter. You
Mhm.
know, finding a sense of humor in dark times always helps. You know, when the stress is high, is seeing something that kind of gives you reason to laugh for a minute.
Mhm.
Always helps. For me, time with family,
Mhm.
absolutely, is a big deal. I love being active. I'm not as active as you are. You do some really cool things. I am
Yeah.
not that disciplined at it,
Yeah.
because how many different sports do you participate in?
Three primary
3
ones.
primary ones. That's
Yeah.
very cool. That's very cool. Very gifted. Very
Mhm.
gifted. And music. I
Mm.
love music. So many people who have visited the pharmacy, whether they're patients or not, many people visit the pharmacy for coffee. We're
Mhm.
well known for sharing the love with a cup of Java.
Yes.
And most of the time too, they'll probably tell you that they hear the radio or something playing
Yeah.
in the pharmacy. So
Do you have a favorite type or genre of music?
I love all music, but I'm an 80s baby. So
Uh,
most of the music that came out of the 80s is really what you'll hear us jamming
all
to.
right. It's funny. I earlier today while we were recording, I got into a conversation about because I had just watched a documentary on the Who's Tommy, which is a rock
Yeah.
opera. Now that's a little bit before the '80s, I
But I remember
understand,
it
but
though. I remember it though.
yeah, I think we're gonna have to dedicate an entire episode to just talking about music. Which decade of music was the best?
Oh,
So our listeners will have to stay tuned for that.
yeah.
Well, I would like to extend some gratitude to Genoa for you guys have also been a faithful sponsor of our Ride for Hope, which is a part of National Mental Health Awareness Month in May. Sadly, we've not been able to host that the last couple of years due to this strange virus that's going around.
Mm,
But hopefully, 22, we will bring it back. And we've always been grateful for your sponsorship of that event.
well, thank you.
You also have grown in what you are providing. So now there's stuff going on in Roane County.
Yes.
Say a little bit about that. What is being offered out there?
So we're super excited that we've gotten to expand our footprint, our Genoa services. And so Ashley, who is my teammate here, is in Roane County now full time, although you see her back and forth sometimes in the pharmacy. But she's in Roane County full time, working with patients the same way that we do here. So sharing with them Genoa services, answering their questions, helping them with anything that might be difficult related to insurance or issues that they might have, easily getting their medication. And then the filling part of the pharmacy services is still handled from here. So we kind of do it as a
Uh-huh.
central fill, but we basically are just super, super happy to have a Genoa person on
Uh-huh.
site in Roane County that gets to work with the patients one on one.
Yep.
And it's kind of neat because we've been working with many of those patients for the 5
Uh-huh.
years. So now, we got to call them and say, hey, the next time you're in,
Yes.
seeing your caregiver, we want you to stop by and say hello to Ashley.
Yes.
You've talked to her on the
Yep.
phone for so long.
And that is that touch again that you
Love
were
it.
talking about before and how valuable that is. Well, my last piece of gratitude is personal in that not only are our clients beneficiaries of the location of the pharmacy, but our staff are as well.
Yes.
And to highlight the 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 touch that you're talking about, uh, I have myself and family members who have benefited from the location of the pharmacy here. I can just, I don't have to drive someplace to get what's prescribed. I can just walk down the hall. But a family member who is going through a life transition received a note wishing her well on this new chapter of her life. That's a touch that I still, I get little chill bumps
Aw,
just thinking
thank
about it.
you.
So I just, those gestures I think are grossly underappreciated. The fact that you guys try to take time to do that when you can is remarkable. It certainly uh, struck her as a very meaningful, positive gesture. So very appreciative of that as well.
That's cool. Thank you so much. I don't think we could do what we do as well if we didn't have the type of partnership we have with Ridgeview. I mean, we feel as one. We feel as family. And what's really cool is that goes even beyond just the staff in the pharmacy. I mean, when, the larger part of my team comes in, my superiors and vice presidents and all of those very special people, they get to spend time with you all, and the interaction is just great. It's just an extended family, and I cannot tell you. Ashley and I joke all the time about how many years we will be here. You probably will never be able to get rid of us. And we are so happy to do it.
Wait until you hear what decade of music I think is the best.
Oh no.
All right. Well, again, thank you so much. I will certainly use this as a leverage point to make sure Jenny rides the bike with us again in
2022.
That's right.
Yep.
So thank you for coming in.
Thank you for having us. We really appreciate it.
Please come back anytime. And we appreciate you taking time out to spend a little time with us this week. Please don't forget to subscribe, ring the bell, and join us for each week's latest episode. Take good care of yourself, and we'll see you next week. Bye-bye.